The SAMPOONATA ABHIYAN has been launched under Niti Aayog, focusing on health, nutrition, agriculture, social development, education across the country, with a focus to attain saturation in 12 key social sector indicators in 500 aspirational blocks and 112 aspirational districts. The comprehensive 3-month campaign from July to September 2024 to be focused on themes including health, nutrition, agriculture, social development, and education will continue till September 2024. As part of the campaign, district and block officials along with elected representatives will organize awareness activities including Gram Sabhas, Nikit Natak, Pausik, Ahar, Mela, health camps, exhibitions, poster making and poem competitions around 12 themes identified in all aspirational blocks and districts. The lunch events were organized across all these aspirational districts and blocks, and the first day of the campaign witnessed the enthusiastic participation from all walks of life. In Churachandpur district, out of the 500 block, Tuibung block and Lamka South block are the 2 blocks selected by the central government. In Churachandpur district, there are 10 blocks where the district is 4,750 square kilometer with a population of 2,74,143 according to 2011 census, with 596 recognized villages. SAMPOONATA ABHIYAN has been aimed to improve targeted 6 different themes such as antenatal care, supplementary nutrition for pregnant women under ICD's program, social health, soil health card under agriculture department, screening of diabetes persons, screening of people with hypertension, and revolving fund for self-help groups under its blocks. The main aim is to achieve saturation in 6 indicators in aspirational block where central scheme reach far-flung and remote areas where common people receive central sponsored schemes. The mentioned selected department will undertake such schemes for implementation and monitoring the said schemes. Before going on the interaction, let me add a few points on soil health card. Recently, where the Union Minister for Agriculture and Farmers Welfare, Arjun Munda, and Union Minister for Rural Development, Giriraj Singh, jointly inaugurated from major key initiative of agriculture sector where revamped soil health card portal and mobile application was also included. This initiative is to benefit the farmers even in remote areas and enable them to do farming with ease. Today we are going to have an interaction under the theme Soil Health Card generated against soil sample collection target from Tuibung block. The SAMPOONATA ABHIYAN has been launched from July 1 across the country in 500 blocks. Tuibung blocks in Churachandpur is one of the blocks. As we are aware that ABHIYAN aims to improve targeted 6 themes, and today we are going to speak about the percentage of soil health cards generated against soil sample collection target from Tuibung block. We have Gracie Haukip, Aspirational Block Fellow from Tuibung block. Gracie, thanking you from Agaspani, Imphal for giving us your valuable time.
Thank you so much, Agaspani, for having me. I'm Gracie. I'm the Aspirational Block Program Fellow for Tuibung.
Welcome. And my first question is, what is the meaning of the term soil health?
Soil health, literally it means that the health of your soil. It refers to the balanced condition of your soil, physical health, chemical health, and biological health, or the process that is conducive to high productivity and high environment quality. It means that if your soil is healthy, they'll be able to reproduce more, and that means they're more fertile.
Thank you. Okay, for my next question, what is soil health card?
So, like in school, we have report cards. The farmers are given soil health cards. It's a printed report that a farmer will be handed over, which will contain the nutrients of the soil. The soil health card contains the status of the soil, which is divided into 12 parameters. There are potassium, iron, zinc, and all of that, and the pH level also. So this is again distributed, or we can say that we have 12 parameters. In these 12 parameters, we have potassium, we have nitrogen, we have iron, zinc, and there are a few others. This is again distributed into few other themes. Number 1 is macronutrients, and then there is secondary nutrients, and there is also micronutrients, and the last one is physical parameters. Based on this, the soil health card will also indicate fertilizer recommendations, and this soil amendment required for the farm will be also written on the soil health card. So if we are talking about soil health card, I would also like to talk about the schemes, soil health card schemes. It was promoted by the Department of Agriculture and Cooperation under the Ministry of Agriculture. It is implemented through the Department of Agriculture of all the state and union territory government. This means that the soil health card is meant to be given to each farmers so that they know the soil nutrients, they know the status of the soil nutrients, and then advice is also given on the dosage of fertilizers and also the need of soil amendments that he should be applying to maintain the soil health in the long run.
Thank you so much. Okay, then what are the process to be enrolled as a card holder?
Soil samples have to be collected from the field of the farmers, and then it has to be submitted along with the document required to the soil testing laboratory.
Okay, thank you. Will soil samples be collected from farmers' field?
Soil samples will be collected by a trained person from a depth of 15 to 20 centimeter. That is done by cutting the soil in V shape. After that, it will be collected from four corners and the center of the field, and from the center of the field, and those will be mixed thoroughly, and a part of that soil mixer will be picked up as a sample. But if we choose the area of set, the samples will not be good, so the area with set should be avoided, and the sample chosen should be bagged and coded. Then it will be transferred to the soil testing laboratory for analysis.
Okay, thank you. What documents are needed to have a soil card?
In order to have a soil health card, there are documents, land documents, which includes land pata, other cards, and then the GPS image of the land location. And then some additional information about the crops, the farmers, what kind of crops have been planted in that very land or soil, and then some small information about the farmers. Those are the documents required to have soil health cards.
Thank you. My next question, how and where will the soil sample be tested?
The soil sample will be tested as per the approved standards for all the agreed 12 parameters in the following way. Number one is at the soil testing labs owned by the Department of Agriculture or authorized outsource agency. For example, we have the District Agriculture Office. They have a soil testing laboratory which is planted in the Office of Agriculture in Churachandpur. And then number two is at ICAR institutions. Like KVKs, we have in Churachandpur, we have Krishi Vigyan Kendra, which is in Piershanmun. We can always get our soil sample, and then that is how it will be done there. And then it will be done by an expert, and then those are the two places where we can get our soil sample tested.
Okay, then what are the process to be enrolled as a card holder?
Soil samples have to be collected from the field of the farmers, and then it has to be submitted along with the document required to the soil testing laboratory.
Benefit of having soil health card.
This soil health card will contain an advisory or suggestions which will be based on the soil nutrient status of the farmer's holding. It will also show recommendations on dosage of different nutrients needed. Further, it will also advise the farmers on the fertilizers and their quantities he should apply, and also the soil amendments that he should undertake, and as to realize optimal yields. And these schemes also monitor soil type and quality, which will further provide the farmers with a report after every 3 years. These reports will include information on the soil nutrients, on the nutrients which the soil lacks, and then they will also give recommendations for improving the soil and the crops. The schemes will also help farmers decide which crop to grow and which to skip. There are concerned government officials. These concerned government officials include the State Director of Agriculture, and for our district we have District Agriculture Officer. We can visit the website www.sampoonata soilhealth.dac.gov.in or www.azricoop.nic.in for information on soil health card schemes. These very schemes, which is very important, all the farmers who have not been registered or who have not obtained their soil health card should visit the nearest agriculture office so that they can get the benefits. And then for any further schemes or any recommendations, we can always approach the agriculture office. And we can also have the benefits of consulting experts, because our traditional ways of farming have, our knowledge have exhaust. So it's time that we look ahead of our traditional way of farming so that we can yield more crops that is also more rewarding than what we are doing now.
Okay, thank you so much, Gracie Haukip, for giving us your valuable time.
Thank you so much.